now, a CDC committee is meeting to vote on a proposal that would lay out the plans for a COVID-19 vaccine distribution here in the U.S. Healthcare workers, patients in nursing homes, and other long-term care facilities are expected to get priority. We're monitoring that meeting. We'll bring you updates just as soon as we get them. And here are the dates to keep in mind moving forward. On December 10th, the FDA will discuss Pfizer's application for emergency use authorization. On December 17th, the FDA will take up Moderna's vaccine candidate. Missouri leaders tell us once Pfizer's vaccine is approved, they expect to get 50,000 doses of the vaccine in the next 2 to 3 weeks. Experts say vaccines will probably not become widely available in the U.S. until spring. A new report has some troubling facts about the way nursing homes in our area are battling the virus. Missouri and Kansas both have more cases and deaths than the national average. And as KMBC 9's Michael Mahoney reports, they are behind on supplies.
The report was compiled by the American Association of Retired Persons from statistics from the Centers for Medicare and Medicaid Services. Missouri has more nursing home deaths per 100 residents than the national average. More cases per 100 residents by the same measure, more staff shortages, and less personal protective equipment, PPE, in nursing homes than the national average.
It is a small fraction of the U.S. population and yet continues to be 40% of the deaths.
That's nationally. More than 3,400 of Missouri's dead are people over the age of 65. The head of the state's Nursing Home Association, Nikki Strong, says many facility residents have underlying conditions.
So it's not surprising that we have in long-term care facilities a higher number of deaths than you'll see in the general population.
And the state's positivity rate is about 20%, which is high. Kansas numbers are similar, except they are at the national average in PPE shortages. Still,
I believe 20.3% of nursing homes in Kansas had less than 1 week of all protective equipment.
Staffing nursing homes is a long-term problem. Ever-changing regulations and dealing with the virus on a daily basis for some has made it worse.
I don't see how the staff has hung on as long as they have because of what they have to adhere to.
As a report shows, both Kansas and Missouri nursing homes struggling with an unrelenting virus. Michael Mahoney, KMBC 9 News.
In Jefferson City, Missouri, lawmakers are working on a bill to spend more to fight the virus, and some of it could go toward the state's 1,200 nursing home facilities. Cases in Missouri are going down. The 7-day rolling average of new cases is down to 3,100. We'll be getting an update from Kansas tomorrow. Missouri's positivity rate is up to 20.5%. In Kansas, the monthly positivity rate is at 18.4%. It is happening nationwide, including right here. Our hospitals are filling up with COVID-19 patients. Doctors at the University of Kansas Health System say they're getting calls from other hospitals all over the country. In fact, Dr. David Wild said just yesterday he got a call from a physician at a Texas hospital looking for an ICU bed for a patient.
That hospital had called 25 hospitals already trying to find an ICU bed for a patient that clearly needed an ICU bed. And so we have those sorts of stories, and we, of course, try to balance that with the needs of people who are here in our communities or in our state. Just in the last week or so.
Dr. Steven Stites, who is on the panel, added that he gets choked up whenever he has to say no to a request for a bed. He says it's a decision that no doctor should have to make. If you think you were exposed to COVID-19 over the Thanksgiving break, call 311. The Kansas City, Missouri Health Department is offering free COVID-19 tests. You must schedule an appointment. There are 2 testing events this week, one on Thursday at Central High School and another Friday at the Parks and Recreation Department.